transverse section of medulla oblongata at the level of the sensory decussation. Sensory decussation means this decussation of internal arcuate fibers related with nucleus gracilis and nucleus cuneatus. Nucleus gracilis related with feet and the lower limb. Nucleus cuneatus related with head and the upper limb. In the medial lemniscus, these fibers after the sensory decussation on the anterior side, feet or lower limb, on the posterior side of medial lemniscus belongs to head and upper limb. Okay, this is medial longitudinal fasciculus. This is medial lemniscus and this is medial longitudinal fasciculus. Medial longitudinal fasciculus belongs to 3rd, 4th and 6th cranial nerve, means extraocular muscles related nerves, then auditory 8th nerve and spinal nucleus of 11th nerve. Okay, so what is the difference between medial longitudinal fasciculus and medial lemniscus? Medial longitudinal fasciculus belongs to auditory, visual and spinal nucleus 11th fibers, and medial lemniscus related with internal arcuate fibers, sensory decussation and posterior column white tract. Now, this is central gray matter. In the central gray matter, nucleus of tractus solitarius, then dorsal nucleus of vagus and hypoglossal nucleus. Nucleus of tractus solitarius related with 7th, 9th and 10th nerve. This is dorsal nucleus of vagus and here is 12th hypoglossal nerve. This is spinal tract and spinal nucleus trigeminal nerve. Here is spinocerebellar tract, dorsal spinocerebellar tract, ventral spinocerebellar tract, and here is lateral spinothalamic tract. What do you mean by spinal lemniscus? Spinal lemniscus means anterior and lateral spinothalamic tract. Okay, this is reticular formation. Here is inferior olivary nucleus and this is pyramid. Once again, transverse section of the medulla oblongata at the level of the sensory decussation. Internal arcuate fibers, nucleus cuneatus, nucleus gracilis, spinal nucleus and spinal tract of trigeminal nerve, dorsal spinocerebellar, ventral spinocerebellar tract, lateral spinothalamic, reticular formation, inferior olivary nucleus, medial longitudinal fasciculus belongs to 3, 4, 6, 8 and 11th spinal. Medial lemniscus belongs to internal arcuate fibers from nucleus gracilis and nucleus cuneatus. Here is pyramid.